Good afternoon, and welcome to our second virtual educational series. Thank you for joining in to stay informed on topics that affect your lives daily. We hope that you'll interact by asking questions on the chat box. Our speaker today got in on the ground floor of Vantage Health Plan and now has over 20 years of experience in the healthcare field. He's now the Director of Sales for Vantage Health Plan, a Louisiana health maintenance organization, or HMO. Just in case you didn't know what HMO stood for. He has been instrumental in the development of key products and outstanding customer service that sets Vantage apart from the industry standard. In June of 1996, he wrote the first fully insured Vantage policy, which is now marketed throughout Louisiana, 6 counties in Arkansas, and will be entering 36 counties in Mississippi in January of 2021. He's actively involved with the Louisiana Association of Health Plans and Louisiana Health Underwriters and has presented at national Medicare conventions and conferences. Please put your hands together and welcome the face of Vantage, Billy Justice.
All right. Well, thank you for that kind introduction, Shara. Shara has been very helpful to me over the years, helping me with many of our Office of Group Benefits employees and retirees, and helping keeping me straight with those. And we've done a great job with the Office of Group Benefits and retirees, and with our Medicare program itself. I know we got our TV is coming up here, correct? So today I'm here to talk to you about Medicare and just some of the ABCs of Medicare. For those of you that may be already in Medicare, just going over a few reminders for you and showing you some things with Medicare that will help you. Everything that I will show you today comes out of the Medicare New Book. If you currently already have Medicare, you should have a red, white, and blue book like this at home. And I'll be telling you some pages today that are very helpful to you in order to help you navigate through the Medicare system. So what is Medicare? Medicare is for those turning 65 or for those with certain disabilities have the Medicare program. It's the red, white, and blue card. While you were working, you were paying into Medicare. Your employer was matching dollars there as well into Social Security. You became eligible for Medicare. That pays for your Part A. Your Part B is for your outpatient physician pieces, home health. Normally, most people are paying about $141 for Part B. Some people are paying less, some people are paying more, but you have to go out and buy Part B. So Part A was your hospital. When you turn 65, you automatically enroll Part A. Part B is the physician piece, and Part B is the prescription drug card. So to be eligible, you have to be at least 65, you have to be a permanent resident, and you must have had paid in to the, sorry about that, paid in to Medicare for at least 10 years and paid Medicare taxes, okay? So, Medicare covers hospital stays, doctor's visits, home health, physical therapy, but there are some things that Medicare does not cover. Original Medicare doesn't cover. Hearing aids, routine eye exams, orthopedic shoes, dental care and denture, health care while you're traveling outside the United States. So if you are traveling outside the United States, you always need to make sure you either have some type of supplement plan that's going to help you, or also have maybe a Medicare Advantage plan that will help you. So when you look at your Medicare New Book, on page 6, it tells you the two different ways to get your Medicare. So you do have the red, white, and blue card, but you actually have a choice. So at certain times of the year, or when you're turning 65, you can actually choose the way you get your Medicare. You can actually go, if A is the hospital, B is physician, and then the prescription drug card is Part D as in dog, you also can go to Medicare Advantage Part C. So you have some options. Sometimes it feels like we have so many options we can't keep up with it and we get confused. The mail and everything's coming to your house. So if you look through the 4 parts of Medicare, A is the hospital, B is going to be outpatient physician, Part D is the prescription drug, and Part C is Medicare Advantage. And what Part C Medicare Advantage will do, it will take A, B, and usually Part D and mold it into one simple plan, and you will get all your health care from the Medicare Advantage plan. Now, the Medicare Advantage plan will tell you they are private companies approved by Medicare. Okay? So when you look at your Medicare New Book, page 6 will show you the 2 different ways to get your Medicare, but on page 57 of the 2021 book, it's going to tell you about Medicare Advantage plans and your options as Medicare Advantage plans. Also in the back of the book, all the prescription drug cards and all the Medicare Advantage plans for your area is in the back of your specific Medicare New Book that Medicare mailed to your house. So make sure when you're picking plans out of the back that you're looking for plans that are in the back of the Medicare New Book. So you can't go wrong. I always tell people about the Medicare New Book. It's your Bible to Medicare. May not get you to heaven, but it will walk you through all of Medicare. Let's look at some things right here. Now, if you join a Medicare Advantage plan, which is Part C, you are still in Medicare and you have all the rights and protections of Medicare. Just because you signed up with a Medicare Advantage plan, you see many of them on TV, a lot of the advertisements are coming at you right now, you are still in Medicare and you have all the rights and protections of Medicare. You get all the Medicare covered services, but if the Medicare Advantage plan does a good job of keeping you healthy, improving quality and reduce costs, Medicare will give those Medicare Advantage plans extra money to give you benefits like dental, vision, money for glasses, transportation benefits, coverage for maybe when you're traveling outside the United States. Many of the plans have that. Gym memberships are also in many of the plans that you see. Transportation to your doctor. Many people are having trouble as they get older. They don't drive anymore. They need to get transportation to the doctor. Many of the health plans will go and pick you up and take you to the physician. So these are the extra benefits. Where do these extra benefits come from? They come from Medicare working with the private industry, the Medicare Advantage plans. If the Medicare Advantage plan can show where they improve quality and help reduce cost, Medicare pays extra money to give you those benefits that normally Medicare will not cover. Dental, vision, transportation to the doctor, over-the-counter benefits are very popular as well. So there are many options for you. As I said earlier, sometimes you have so many options you really can't keep up with it all. And during those certain times of the year, between October 15th and December 7th, that is the time when everyone in the United States that has Medicare chooses for what they want to do for the upcoming year. So you'll probably see mid-September, that's when the mail started coming. And it's coming to your house right now. So I always tell people, I like to tease them, if it doesn't have Vantage on it, just throw it away. But that is why you're receiving so much mail, particularly in September, all the way through December 7th. Now, many of these plans have prescription drug coverage in them. If you sign up with just original Medicare and you don't have a prescription drug card, you have to buy a prescription drug card. Many times you will pay a premium each month for these drug cards. They normally run $17 to as much as $85 to $90 per month just for the drug card. And then on top of that, you have copays that are mixed with it. So a prescription drug plan, Part D, as in dog, is your prescription drug coverage. So you have to be careful with that. When you sign up with these different plans, you need to make sure that your particular drug is covered. If it is covered, what is it going to cost you per month? Many times you may sign up with something you've seen on TV, or you get into a plan and whoever you purchased it from, you didn't do a good enough job of looking at your specific prescriptions. You need to know before you make your decision, how much are those prescriptions going to cost you? Once you make that decision and you're locked in, we can't change the price on those drugs for a year. So you should be locked in, but you need to make sure you look at ahead of time of what those drugs are going to cost you. Now, the prescription drug card has improved over the last 4 or 5 years. Many of you have heard of the donut hole or the coverage gap in the prescription drug costs. So in the past, a certain percentage of your drugs were covered, then you went to a donut hole where you had to pay almost all of the cost for those drugs, and then if you spent enough money, you would come out and get a much better relief. But many people through the first 5 or 6 months were not paying a lot for their prescriptions, and then all of a sudden you go to the pharmacy and they want $200 or $300 for a prescription. More than likely, this is what happened is you've gone in the donut hole. So I have a screen up here. So if you look initially, the easiest way that I've learned to explain this is for 2021. Every time you go to the pharmacy, you may pay a copayment, or you may have a plan that gives you a drug where the drug doesn't cost you anything. But when you and the insurance company combined together has spent $4,130 together, you then go into a donut hole, and this is a coverage gap. In the past, the member, you, had to pay all of those costs for the coverage gap. Through improvements through the Affordable Care Act and improvements in Medicare over the last 4 or 5 years, now the pharmaceutical company is going to help pay your cost while you're in the donut hole. So from $4,130 to $10,150, the pharmaceutical company is going to pay 75% of those costs. You, the member, are going to pay the other 25%. Sometimes that may be better than what you were doing when you first started, sometimes less, but in most cases you're probably going to pay more money while you're in the donut hole. So how do I stay out of this donut hole when I'm going through part of the year? The key is talking to your physicians. Most health plans and most drug cards will have a low-cost generic list. The key is taking that list to your physician and asking them, is there anything in a low-cost generic that I may be able to take in order to help cover my cost through this donut hole? One exciting thing that has happened this year, and one of the changes that has happened, is the diabetic pens that are up. The diabetic pens are very expensive, but now through some legislation and some cost improvements by Medicare, many of these diabetic pens that were anywhere from $100 to $200 a month will now only cost you $35. The key is checking with your health plan and asking them in 2021, do you participate in the insulin diabetic program? If your plan does, many of you who are on insulin pens, not all, but most of those pens, you're going to see an improvement in the cost to you when you go and have those prescriptions filled at the pharmacy. We're seeing a lot of excitement. People are seeing prescription drugs for those diabetic pens, $150, $200 a month, are now going down to $35 copay. And that's very exciting. One of those good improvements for Medicare recipients, particularly those that are on diabetics. Let's go to a slide here real quick. So let's look at your annual enrollment periods that happen each year. October 15th to December 7th, that's your annual enrollment. One thing that happened again last year and is going to happen again for 2021, from January 1st to March 31st, it's going to open back up again. If you weren't satisfied with the move that you made, let's say you joined a Medicare Advantage plan and you want to switch to another Medicare Advantage plan, or you switch to one, you want to switch back to the one you had the year before, you can make that switch. You can go from a drug plan to a Medicare Advantage plan. So they are going to open it up January 1st to March 31st. What does that mean to you? The television advertisements aren't going to stop coming. Every time you go to a commercial break, you can almost always see a Medicare commercial geared towards you for you to call some number and try to get you to do something. The mail's not going to stop coming either. So mail will continue to hit mailboxes, television commercials will continue to be out there. The key is when you're buying something off TV, or I always encourage people to always try to check with a local agent to try to know exactly what you're getting that has your best interest, and they've checked your doctors in the network and also checked your prescription drug cost. Very, very important. A couple other things here. I want for those of you that are turning 65 out there, well, what about me? I'm turning 65. When you turn 64, probably by your third month into your 64th birthday, you are starting to get mail. Little teasers out there. 65 is coming. Are you prepared? Learn what you need to do when you're turning 65. Generally, 3 months before your 65th birthday, you're going to get Part A automatically enrolled. If I were you, 3 months out, I would start looking at the Social Security website and signing up for Part B, as in boy. So you want to get the red, white, and blue card sent to you on your 65th birthday or by your 65th birthday that has the red, white, and blue card, has your Medicare number, and it has Medicare A and B on it. So if you have Medicare A and B, once you have that red, white, and blue card, you then at that point, you could go out and buy a Medicare supplement to help pay what Medicare doesn't pay. You can also go out and purchase a prescription drug card, or you can go ahead and enroll into a Medicare Advantage plan. To enroll in the Medicare Advantage plans, you have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. See back here, look at one other thing here, see what I may have missed. Right. Here. So I'm going back, when we look at Part A is your hospital, Part B is your physician outpatient, Part D is your prescription drugs, and Part C is Medicare Advantage. Just real quick, if you go back to your Medicare New Book, everything you really need to know about Medicare is in that Medicare New Book. Okay? We encourage you to read it. It's well written. If you're eligible for Part B, what am I going to have to pay for Part B? If I didn't sign up for a prescription drug card when I was eligible, am I going to have to pay a penalty? If I have employer coverage, how is Medicare going to work with employer coverage? These are all questions that you may have, and many of those answers are directly in the Medicare New Book. And we encourage you to roll through that book and get many of your questions answered in the Medicare New Book. Again, on page 6 of that book, it tells you the 2 different ways to get your Medicare. Okay? 2 of the main changes that you're going to see for 2021, annual enrollment will then be called open enrollment from January 1st to March 31st. You can have a chance to switch again. You possibly have a chance to switch there. For those that have low income subsidy or also have Medicaid, you can change every quarter. So that change is coming there. You'll have another opportunity. And then also I would look at changes in your prescription drug card, and also look at the new diabetic pens that are going to have the $35 copay. Many of the Medicare Advantage plans that are out there cover transportation to your doctor, dental, vision for glasses, gym memberships, over-the-counter benefits. These will be all extra benefits that you may be eligible for and that you may want to sign up for. But I always say buyer beware. Try to shop local if you can. Find a local agent or call the company directly to make sure that the people that are looking at your particular situation, that don't just sign up for something, make sure that they've looked up your prescription drug cost so that you know what your prescriptions are going to cost you when you sign up. Make sure that your doctor and pharmacy are in the network that you normally use. Many times you may sign up with a plan, but the doctors that you use may not participate with that plan. So it's very important to make sure that your doctor and your prescriptions are taken care of for that. Again, January 1st to March 31st, when this is all over December 7th, it's going to start back up again for 3 months. The diabetic pens is that, and then also many of the health plans have changed. Your co-payments may have gotten higher. You should have gotten an annual notice of change early October that explained all the changes in your plan. And then also some of the plans, their benefits actually got better for you. So that's why it's time to shop between October 15th and December 7th. With that, I think we're going to open it up for questions to see if we have anyone that wants to have some questions sent in.
Well, we do have one question. Like, how do you know which type of plan is best for you? Do you look at your income? Is it a combination of things? Like, if you have Medicare and you have a supplement, why would that be better than an Advantage plan?
Right. Well, everyone has different needs, and the key is doing the shopping before 2021. So if you have a Medicare supplement, generally when you turn 65, the Medicare supplements are not that expensive, but you also have to buy a drug card. So normally you can get into some type of Medicare supplement to help pay what Medicare doesn't pay, and a drug card for around $100 to $120 a month. Some people want to save that $120 a month. They may want to go to a Medicare Advantage plan. They say, look, I simply just can't afford a Medicare supplement. I can't afford a drug card. But with the Medicare Advantage Zero Premium plan, I may have some copays when I go to the doctor, but I don't have to pay anything each month. So a lot of times you have to evaluate your own health. How often am I going to the doctor? How often am I in the hospital? But then also as you get older, those supplements start rising. You see many of these plans are getting $200, $300 per month, and you have to buy a prescription drug card on top of that. If that's the case, you may start looking at the Medicare Advantage plan at that point. Many of these could save. We see people, in many times, they could actually join a particular plan and save $2,000 or $3,000 a month. The key, I believe, is trying to sit down with someone who knows something about Medicare and going through your expenses. For those of you that may be older, I always say every Thanksgiving and Christmas when the children come home, it would be a great time to go over your Medicare plan with your children so that they know what plan you're in, what your prescriptions are costing you, and shop at that point to see if there's something better for you that may be less expensive, but also cover your doctor and the particular prescriptions that you're on. Any other questions?
We do have another question. Are hearing aids covered in an Advantage plan, or does it just depend on the plan?
Yeah, it depends. Original Medicare in most cases will not cover the hearing aid. So those all kind of plans that are out there where you can buy hearing programs and so forth. Many of the Medicare Advantage plans will give you an allowance for a hearing aid. Some may not. It depends on the plan that you're in. So some plans will give you an allotment for hearing aids to apply towards that cost. Others simply don't have hearing in them at all. It depends on, you have to shop each Medicare Advantage plan to look at what extra benefits that are important to you. If dental is mostly important to you, look at a plan that's stacked heavily in dental. If rides to your doctor are important, you may say, well, I don't need a hearing aid, but I need rides to my doctor. This plan has a significant number of rides to the doctor plus my doctors in the network. So it's really hard to say what plan's best. The key is that you're going to have an array of plans to choose from and to ask specific questions to the agent selling you the plan about your particular needs. Next question.
Well, here's a question for you. Once you have a plan and your doctor, say you had to have heart surgery, and your doctor, you have all these people that he has referred you to that become a part of what you have to do to get ready for this surgery. How do you know if they're in network? What do you do to find out ahead of time?
Yes. Well, again, you got to go back to the plan. I always ask people this whenever I'm speaking at seminars, and I know in the future we're going to have very soon some more virtual seminars where we can go through specific benefits. But here's a question I always ask. How many people out there know who your radiologist is? How about your anesthesiologist? You've ever had surgery or needed anesthesia and you know who your anesthesiologist is? Or if you've ever had blood work, who is your pathologist? And 99% of the times people say, I don't know who my anesthesiologist is, I don't know who my radiologist is, and I don't know who my pathologist is. So when you look at these plans, I always say the bold print will giveth and the fine print will taketh away. So many times you think that your costs are here, but you forget about those pesky bills that come in the mail. Radiologist, anesthesiologist, pathologist. When you're in the hospital, often doctors come running like cows to the feed trough. Everybody wants a check. Everything's wrong with you. And then you start seeing all these bills show up at your house. Look at your particular plan to see how it's going to cover inpatient physicians. How is my plan going to cover radiologists, anesthesiologists, and pathologists? There are solutions for that out there. There are plans that cover all that. You have to make sure you're in the right plan.
That's a very good answer. I understand that there are members of Congress who are proposing more transparency in, particularly in Medicare plans, but in all health plans. And what does that mean, transparency?
I think more than anything, it's just when you go to the doctor or you go to the hospital, it's how much am I going to have to pay? And can I do any kind of shopping ahead of time? Like if I needed an MRI, is it cheaper for me to go to this facility or that facility? Most of the good plans have really already done the shopping for you. They've already negotiated out a pretty good rate. You've already agreed to price for your insurance already. And generally in most places, if there's a better discount, they may say if you go this particular provider, you may only have to pay $100 for your MRI, but if you go to this one over here, you may have to pay $200. So often the insurance company may do that for you, where they give you a list of hospitals and doctors with lower co-payments because they have actually negotiated a better rate. But I think many times people are just looking out there. It's really hard to say, what is this particular surgery going to cost me at this particular facility? So I think what they're gearing for is more transparency so that you, the member, know what exactly is my insurance company going to have to spend, or what is my true cost once I go. And I think the key is what's really trapping people down. It's back to that thing where the bold print giveth and the fine print taketh away. We see this happen all the time where someone goes to a primary care doctor and they have a zero copay for primary care. They've jumped into a plan that has zero copay for primary care. Well, many times when you go to that primary care doctor, you may have an EKG, spirometry. You may have blood work. The blood work is often sent to a lab that's down the street or to an off-site lab. The lab work is done, and often the lab doesn't bill the member, they bill the doctor, and then the doctor sends you a bill. And you're saying, well, wait a minute, I thought I had a zero copay for primary care. Well, yeah, that's just to walk in. If we start doing anything, you're going to have to pay. So many of these plans, I often call it trickery, where they have a zero copay for primary care, but then you have all these little things that crop up and those bills come in the mail. Always be aware of that. There are some plans out there where the plan is not only a zero copay, but the lab work is covered in and out of the doctor's office at 100%. And so if you're looking at a low copay for primary care, you want to make sure that you're looking, well, what is my lab work going to cost me? Is there a pathology bill that's coming later that I may not be aware of? Nothing worse than going in there for zero copay and then you're getting a $50 to $75 to $100 lab bill coming 2 weeks down the road.
We have this question. If you were previously a Vantage member, any problems with going back to the zero monthly?
Well, between October 15th and December 7th, that is the time when you want to make your choice for what plan you want to be in. So if you were a Vantage member and you were in a premium plan where you were paying a monthly premium, look at the new premiums, because some of those costs went down. That standard plan went down to like $32 a month. But the zero premium, if you want to go back to the zero premium plan, it is still available in every parish in Louisiana as well. I think some people may be in Arkansas and Mississippi, so the co-payments vary in each state, but look at your particular plan finder in your particular county or parish. But if you are in Vantage and you were paying a premium and you want to go back to the zero premium plan, between October 15th and December 7th is the time to do that. You can actually call our member services line and actually do that over the phone.
Thank you. We have so many comments that your advice is excellent advice, and they're so glad you did this. What if someone wanted to know about specific Advantage plans or Medicare plans administered through a company, or which way to go? Who would they get in touch with?
Depending on where you're at in the state, if you see a particular benefit or a particular company you like, often you can call them direct. But there are so many independent producers that are out there that are helping sell prescription drug plans and Medicare Advantage plans. In order to be able to sell a Medicare Advantage plan or a prescription drug plan, the agent must have certain certifications. They must be licensed through the state of Louisiana for their health and accident certificate. And they also have to take a national standard test by Medicare. So Medicare doesn't just send, or when Vantage enrolls these independent producers to help us go out to market and sell, they have to go through specific training. They have to go have a license to sell insurance, and then they have to go through Vantage training. And I personally put my eyes, I've got 1,000 agents out there, but I put my eyes on each and every one of them. I bring them into rooms, I train them, I talk to them, let them know what we allow, what we don't allow. But the key is making sure that that agent, that you pick out a good agent. You can also call the company directly, but if someone comes to your house, making sure that you have a mask, the agent has a mask and gloves. Many of these agents now through COVID can actually help you enroll over the phone. So they may do a phone interview with you and answer a lot of your questions by phone as opposed to face-to-face. But then after you make your decision, they actually can call in and help enroll right over the phone. But the key is there are so many independent agents out there, you're getting all kinds of mail. Some of those independent producers will send you a mail piece, but if you have a particular company that that is drawing your interest, like Vantage, if you would call us, we can have someone help you enroll over the phone. We can get an agent to your home if you want a home visit. We follow all the CDC guidelines, mask, distancing, to make sure, particularly for the COVID crisis that we're in, to make sure that we keep everyone safe. But I would call the company directly. They can get a representative, or they can help you answer your questions over the phone and actually enroll you over the phone. And right now, due to COVID, the phone over the enrollment has really ramped up. So many people are enrolling over the phone and changing plans over the phone as opposed to having someone come to their house.
Thank you. We have a couple of comments that they say they wish Medicare wasn't so complicated. But
Well,
I think you've done a good job of breaking it down for us. I really do. Excellent.
Yeah. The key, I'm always leery of what does the government do right and what does the government do wrong. And the more I've been in doing this little red, white, and blue book, I think it's very tastefully done, and it's just really does a great job of explaining all the A, B, C's, and D's of Medicare. Again, if you go back and write this down if you're at home, if you would just go to the 2021 book and go to page 6, it tells you the 2 different ways you can get your Medicare. But when you join a Medicare Advantage plan, these plans must be approved by Medicare. You have all the rights and protections of Medicare. You get all the Medicare covered services. But the Medicare Advantage plan works with your doctor, your pharmacy, and Medicare, and you. And if they can improve the quality and reduce the cost, you get extra benefits that are into the plan. So some of those savings that Medicare has, they're giving it back to the member as a reward. I know our particular company, In 2019, we did 6,000 home visits with nurse practitioners, going into the home, virtual telephone conferences, making sure people got their wellness, making sure that they're doing their blood work and so forth. But if you have Medicare, we encourage you all to go in every year to get your wellness exam. Medicare wants to know what particular illnesses you have, and once you have that wellness exam, the Medicare Advantage plan can start working with different avenues to make sure you're getting the appropriate care that you need. So make sure you get that wellness visit, get your lab work done. Mammograms, colonoscopies, diabetic eye exams, all these things are very important. You'll often see that the insurance company will send you reminders to your home, or they will also call your doctor. They will call you, hey, it's your time for this particular test. Don't forget to go in. And the health plans are rewarded when you take the responsibility to improve the quality of your care.
We do have a few more questions. Number one, are there any pre-existing clauses?
Yes. With Medicare, there are no pre-existing conditions, and this is an excellent question because in the past, with Medicare Advantage Part C, these private plans, there are no pre-existing conditions in those as well. Before 2021, if you had end-stage renal disease and you were on dialysis, you could not join a Medicare Advantage plan. Medicare had those individuals in a separate group. In 2021, even people with end-stage renal disease, need a kidney transplant or so forth, can also join. The reason why there are no pre-existing conditions in Medicare Advantage is you're not buying a supplement, you're buying actually Medicare itself. So pretty much most health plans, even in commercial plans or individuals, there are no pre-existing conditions. So if you're like with the Office of Group Benefits, all those plans that are there, there's no pre-existing conditions. I know that you see a lot on the news, well, it may go to the Supreme Court to do away with the Affordable Care Act. Is that going to hurt pre-existing conditions? My personal assessment, I just don't look for pre-existing conditions to be levied on someone. I think you're always going to have plans out there with no pre-existing conditions. All of our congressmen and most of our senators that I know out there, all of them, they don't want pre-existing conditions. I don't think the current administration or anyone wanting to come in wants pre-existing conditions. So I think for those of you that have pre-existing conditions, I think we can ease up on that. I think we may try to improve Medicare more and more, improve the Affordable Care Act, but I don't look for pre-existing conditions where you can't sign up for a health plan because you have pre-existing conditions. I just really don't see that happening. There's a lot of hype on TV during election time for that to generate excitement, and generate energy one way or the other. But I just simply personally don't see that happening. If you think for a chance that there might be pre-existing conditions levied on you, I would go ahead and call my congressman's office or my senator's office and say, look, I just want to make sure whatever we do with health care, we don't want pre-existing conditions. But I don't really see that happening.
We have a question about plans. This says, I'm in a zero plan. If I go one up plan, will my drug plan be cheaper?
It depends on the prescription medications you're on. So if you're in the zero premium plan, we would need to look at your particular drugs that you're taking to see if it's going to save you money. So the new standard plan is going to be in Louisiana $32 a month. In Mississippi, it's going to be about $26 a month. And I think also $32 a month in Arkansas. So you will buy up. What you have to do is see if the premium you pay every month, you got to add that money up, and is it going to be cheaper to pay the premium along with the copays? Everybody's different. So this is the time where you say, hey, I want to look at what my drugs will cost me in a premium plan that I got to pay for each month. It may save you enough money where it's worth the $30-something a month. But the key is most plans, including ours, there's a zero list of drugs. Talk to your doctor about low-cost generics that don't cost you any money. Now, those insulin pens that we talked about are going to be covered with no deductible and also covered through the donut hole. So the whole 12 months, if you're on certain insulin pens, $35 a month, that is going to be a great, great deal for you, the Medicare recipient.
Can you find a Plan C by zip code?
You can if you go to the Medicare website. They will ask for your address, your zip code. It will give you a list, but also in the back of the Medicare New Book, all of your Medicare Advantage plans that are available for you with just a few of the benefits are in the back. So, like in the back of your Medicare, it just so happens I turned a page where Vantage Health Plan is one of your choices. But all the choices are in the back of the book. You receive this book at home. If you got this book, if you're looking to shop Medicare Advantage plans, look in the back. An exchange of plans is in the back of the book. I always just so happen to turn to the letter V for some reason. I just can't figure that out. It won't go to any other plan in my book, but there actually are a lot of good plans that are out there. The competition in these plans is fierce, and that's good for you, the Medicare recipient. So if you have Medicare out there, all these different companies that have these Medicare Advantage plans, they want your business. In order to earn your business, they're going to have good customer service. They're going to also have to work with your doctor to make sure that your doctor's happy. How well is this health plan? They may have great benefits, but they may not work with your doctor very well. Doctor may not like them. So in the game that we're playing today, like Vantage, we have to also, our sales force has to be happy. You, the member, has to be happy. Great customer service, great benefits. But that doesn't mean anything if the doctor tells you to get out. So we are spending countless hours in massive departments that go out every day and meet with doctors, hospitals, physical therapists, home health agencies, all those to make sure that the people that you're seeing for your health care, that they are as satisfied as you are. And that is really, really good for you because the competition in the private market is becoming so fierce. Look at all the extra benefits, and they just keep ramping them up and ramping them up. There are a lot of extra benefits in many of these plans that original Medicare did not cover in the past. They're covered now. So when you look at the breakdown, 40% of everyone in the United States currently, right at 40%, are enrolled in private Medicare Advantage plans. They say in the next 7 or 8 years, it could go as high as 70% because of the competition in the market, driving down the cost and improving the quality. In the improvements for customer service is really standing out as well.
What about the star rating plan that Medicare has?
Well, the star rating for Medicare Advantage, every health plan has a star rating, with 1 being terrible, 5 being star. So as a health plan, we are all striving to be 5-star plans. It would be the greatest thing to market. So if your star rating is 4 stars or higher, it may be 4.5 stars or 5 stars. If your overall rating of your star rating is 4 or higher, then you get a 5% bonus to give you extra benefits: dental, vision, transportation, all the things that original Medicare did not cover, you can get. But what makes up the star rating? Well, if a lady doesn't go have her mammogram, they're not going to take away her Medicare. They're going to punish the health plan you're enrolled in. That's part of your star rating. Diabetic eye exams, hemoglobin A1C blood work, how our customer service, how you rate our customer service. You may get a survey in the mail, the CAP survey that goes out. Medicare wants to know how your health plan is doing. Can you find your drug on the prescription drug card? Are the drugs at this particular plan, how reasonable and affordable are they? Medication adherence for blood pressure, cholesterol, or diabetes. If you're taking medications for blood pressure, cholesterol, or diabetes, you have to get that prescription filled a certain number of times during the year in order for you to be adherent to your medication. If you don't get your prescriptions filled, you don't get your diabetic eye exams, you don't get your mammograms, colonoscopies, your physicals, if you don't do all that, they're not going to take anything away from you, but they will punish the health plan you're enrolled in. If my star rating falls below 4, they're going to take 5% away from me. I'm going to have to go up on your premiums, and I'm going to have to reduce your benefits. I hope I explained that in a very simple term.
So when we get, those of us who are in Medicare program, when we get those phone calls or those emails that say, well, how was your experience and how did we do? That's all part of the star rating.
Many of these surveys, sometimes Medicare will send you a particular survey, like what they call it a health outcome survey. You may have a particular illness, and Medicare will send you a survey and say, and ask you questions specifically about your illness. It's always important to fill those out and get those in. Those are all part of our star rating. We need to know how we're doing. Like flu shots. Medicare will ask you in a survey, did you get your flu shot this year? And they say maybe since June or whatever, they'll give you some time frames. They ask, did you get your flu shots? And we'll get a star rating between 1 and 5 on flu shots. Historically, we've only gotten 2 out of 5 stars for flu shots. Many people still do not go get the flu shot. Talk to your doctor about the flu shot. Some people say, no, it's going to give me the flu, I'm going to get sick, or it'll make my electric bill go up, or whatever. I've heard it all. All the reasons for not to get if I get the flu shot, then I won't be able to eat, or there's just all kinds of things. It makes it rain outside if I get the flu shot. It's talk to your doctor about the flu shot and the different strands of flu that it may cover, but I always encourage people to get their flu shot. Very, very important.
All right. Well, those are some really good answers. I'm still waiting to see if our viewing audience has any other questions. If you do, if you'll just type those in right now, we'll be sure to cover that. We'll give you a few minutes. Do you have anything that you can think of that we might need to know as that you've not covered or you've not brought up?
Yeah. Well, I'll say this. Obviously, for the COVID-19, the coronavirus, it has totally disrupted, obviously, the entire country and everything that we're doing. On our health insurance side, the health plans have stepped up to pay deductibles and co-payments for coronavirus-related illnesses. That's very important. It's changed our whole marketing strategy and how we get to you, because many people don't want anyone coming to their home, obviously. So it's changed up how we do business. The phone lines are blowing up, so be patient. If someone doesn't answer, if you would actually go to our website where it says contact us, if you can just give us your name and number. Hey, I have questions about my particular plan. I would like for an agent to call me. Or if you're turning 65, you need someone to sit down with you and go over these A, B's, and C's again, show you your choices. We can have people do that. If we do a home visit, our agents that we have licensed are trained on the Center of Disease Control regulations to make sure they keep you safe as well if they come in the home. But many people don't do that. So if you're calling, be patient. The phone lines, we've got plenty of people on the phones, but there's so many people calling that would normally do this in a face-to-face meeting. I'm really missing our restaurant meetings this year. I know many people probably that are out there would come to a restaurant meeting and a Vantage representative or a representative would go over the benefits, the changes, answer questions, sign up, change plans. We're not allowed to do that this year. Hopefully next year we can get back to that, or we can have more meetings where I kind of like to put my eyes on people. I'm talking to a camera right now, so it's kind of hard.
Okay, well that is very good information, and our viewing audience appreciates this so much. We're seeing that in the comments. We hope that you'll come back again at some time in the future and talk some more. I do know that you plan to have presentations through the marketing and sales department on specific plans that your company has. This, we hope, satisfies the public in that it was a general view of Medicare overall. And there are different plans, and you have to look at it to choose the one that's right for you. We really appreciate your viewing today. We'll be having another planned program in the near future. We hope that you will watch for us and tune in. Thank you.